So maybe to start off, can you give a high level overview of what enhanced care management means at AFS?
Sure. So at AFS, Enhanced Care Management started out just with Alameda County. And over the last 6 months, we have now expanded to other counties, Sacramento, Napa, Solano, Sonoma, and I think at some point and San Francisco. So it is fairly agency wide, and this is a unique opportunity because we're actually serving individuals and families that are not AFS clients. These are individuals that are not receiving AFS services like foster care, mental health services, and the referral base is strictly from managed care plans. So we're working with the healthcare system. It's like in Alameda County, we're partnered with Alameda Alliance, and in Sacramento, it's with Kaiser. So each county, there's a different managed care plan, but they're all Medi-Cal recipients. So we serve what we call a population of focus, there's 9 populations of focus. And, off the top of my head, what we tend to get a lot of in Alameda County in particular is the unhoused. So supporting individuals and families we currently have a family that's living, I don't know if you're familiar with Oakland, but Oakland has a lot of homeless camps. And one of the families is actually living in one of the camps nearby our office. So it's unhoused families. It's for kids with complex mental health needs. It's for, I'm trying to remember all the populations of focus. Pregnant women and families that are in need of support in food stamps, understanding how to be able to provide for their children and family. So a lot of the enhanced care management, the team is the lead care manager. That is a case manager who is assigned to this family. And it's really a family. This is not individual based. It is serving families. And that lead care manager can have up to 25 to 30 clients or families that they're serving at one time. And a lot of it is it's linking families to the resources that they need in order to support them, for instance, not having to continuously seek healthcare. Like these are individuals that might be diabetic, right? And so they're always going to the hospital or getting some sort of treatment, but an LCM can help them with, let's say, dietary plans, right? So that they're not having to go back and forth into a hospital setting to receive the care. And it's exciting because it's like we're implementing a brand new program. I mean, we've been doing foster care for what, 45, 50 years almost. So this is now serving actual families that we get to meet. Like it's literally a page. We get a referral and we get to meet them in their community. We're not asking them to come to the office. It's like if they need us to meet them at their home, then we will meet them at their home. If they would prefer us meeting them in the community, then we will do that too. And we're accessible. It's just one of those services where the lead care managers are always in need because these families are vulnerable in different ways. So we're implementing and learning at the same time of, you know, some of this work crosses over with working with foster youth and, CPS reporting, those things that we all learn and train on as a foster care agency, but this is also crossing over into enhanced care management. And not to say I want to make CPS reports, but like one of my LCMs reached out, this was last week, and she said, I'm really worried because this is the unhoused family. It's a mom and two very young children. And she's concerned about their living environment. They're living with, within a homeless camp. And she said, is this a CPS report? And I said, well, in the state of California, being unhoused is not a CPS report. And what we really want to do is better understand how they got to this place, right? And prevent kids from coming into care. Like this is a preventative measure. So let's not promote reporting unless it's like an unsafe situation. A child is being physically abused, right? And we observe marks on a child. But if being unhoused and being concerned about that type of living arrangement is not something that we are mandated to report. So there's, there, but I understood why she went to that place of like, she's worried about the children, right? And the beauty of this is like, we meet them where they're at. And, prevention is a big part of this program. Did that answer your question? I gave you a lot.
That was a lot, and I appreciate that. I guess if I'm kind of the overarching idea and sort of why AFS is doing this is if we see that there's kind of certain commonalities, say, among vulnerable families where AFS would traditionally see them, after the county and CPS is getting involved, the idea is that, well, there's families are in need of services and support and help prior to that moment. And if
Exactly.
there's a way in which all of the support and services AFS has historically provided can then happen, you know, before you're getting this level of involvement,
Right.
it's to ideally, hopefully, to the family's benefit.
Exactly. And we do offer support to, for example, they're called reverse referrals. So if we have a young adult in one of our foster homes, and they're on the verge of, transitioning into a different living arrangement, right? They're like, I'm ready to leave. And I can actually go to, we're contracted with Full Circle Health Network. And I can go to them and say, I currently have this non-minor dependent. I would like to reverse this referral because they're an internal client already and request that ECM be a service that gets approved for this young person. And we can actually follow that youth outside of care, like linking them to employment opportunities, housing, right? Seeking housing for them. So it's really a matter of how to help them succeed once they're no longer under the umbrella of AFS and fostering, right? So that's exciting. And for kids that reunify as well. I mean, we've never done that before, where we can follow a family post reunification, right? And support that family because what we want to, once again, prevent is for kids to come back into care. They have been, the family's been working really hard to earn this back, right? Like, have their kids back home and we can follow them. We haven't done it yet, and I'm waiting for the opportunity to be able to do that. But that's another beautiful part about this service. And because there's been too many cases where kids go back home and not at the fault of the family, right? But somehow they're reoffended. And it's like, here they come back again. And that whole cycle, it takes years. So that's one day I'm going to have one of those families where we can support them outside of the entity of AFS, right?
Yeah, I think that makes a ton of sense. And I'm curious maybe a little bit on the logistics. Can you speak a
Uh-huh.
little bit about how a family sort of would first enter the enhanced care management orbit
Uh-huh.
and sort of you said it was like licensed LCMs, licensed care managers,
They're lead care managers.
lead care managers, thank you.
Yes.
And
Uh-huh.
like so how they enter the AFS orbit for ECM and then like what does the service model look like? It's like what kind of services would an LCM provide?
So we receive referrals directly from Full Circle, and I have a supervising lead care manager who receives those phone calls from Full Circle stating, we have these referrals for you, and we assign, right, to one of the three. I currently have three LCMs for Alameda County. And that LCM is to make, at the very least, a phone contact, reach out and to the family within 5 days of us receiving the referral. And from that point on, the next contact is to be an in-person. So there has to be one in-person visit per month. So very similar to, the county, right? A county social worker is to make visits with their clients once a month. So our lead care managers do the same, but they're meeting the families, like I said earlier, in their community. Now, we also assess for safety, right? So if the LCM feels that they're unsure of whether they can go out and meet with the person in their community, then we invite them into our office. And so it's like a scheduled in person at the Oakland office, and they get to meet the family and start to build the rapport and an opportunity to explain why, they've been referred. Some families are confused. They're like, why are you calling me? And what is this service about? And what they don't realize, or maybe they've forgotten, is like they recently went to a doctor. The doctors thought, oh, this could be a great opportunity for this family to receive ECM services. So they make a direct referral, right? So some families forget that that's what is being talked about. So it's educating them on what the LCM is there to do for them. And then they do what they call, first, it's like a risk assessment, right? And then they also do a care plan. So they're assessing risk and needs for this family, but then also putting it into an individualized care plan. And there are goals associated. So that's also what the LCM is talking to the family about. And when it may not be it takes more than one visit to do that. It's a lot sometimes, and sometimes families just need space to vent, or like share their struggles. So it could feel very much like a therapy session, first off. So it's not, sometimes you don't want to ask too many questions all at once, right? So you're building that rapport. And then after the first visit, LCMs are reaching out at least one time per week via phone or Zoom. They'll do some Zoom meetings with them just to get face-to-face contact. And then they're just running. The LCMs have learned resources to offer, and by just doing research or talking amongst themselves, like that's where I was this morning. I had group supervision with my three LCMs and the supervising LCM to talk about, like, hey, I have this family. So it's like case consultation, but then also sharing resources with one another. Um, and we do have one bilingual LCM because we do have a great need for Spanish speaking families. That's what the LCMs do.
So if I'm understanding correctly, the idea is essentially listening to the families, getting like learning more about them, and then from there trying to understand what their needs are and then
Mhm.
connecting them with relevant services, whether it's additional health support, mental health support, housing, job, education, kind of whatever they need, the LCM is sort of helping to facilitate. Is that the idea?
Yes. And LCMs can also, we have a family where they have some medical needs, right? And but they also have children that they can't always be schlepping back and forth to doctor's appointments. So the LCM will support that parent in taking them to their medical appointments or supporting around the kids being left at home and helping figuring out a plan of support for them when the caregiver has to go to doctor's appointments. So they're an integral part in what I believe is like when you're in dire situations, right? You're not always thinking clearly. And so the LCM is there to, in those conversations, really pinpoint, hone in on what is needed. And a lot of it is like thinking outside of the box too. There's and the bigger picture of things. Because when you're in crisis, because a lot of these families are in crisis, you're stuck in the moment. It's hard to get out of it, right? So the LCMs do that level of work and support for them.
Yeah, that makes a lot of sense. I'm curious, this level of care and this model, because it's different than maybe what AFS has been doing historically,
Mhm.
how do you determine success?
So the individualized care plan, where they identify goals, right? The goals can change, right? You could meet those goals in a certain period of time and then you add new goals to it. So really that's the tool that the LCM and the families utilize to see whether to assess services, right? But then to also assess success for the family. So that is their their place that they can reference. Um, we have, I'm wondering in the last, I'm trying to think if we've discharged any clients at this point. I don't think we've discharged due to meeting goals just yet, but it's been around families that are just haven't been engaging in services. And ECM can follow them for a longer period of time. To be honest, I'm gonna have to look into this, whether there is like an end time or not. But I will say in the last 6 months, what the families at the Alameda LCMs have been supporting, I don't recall like families have met goals just yet.
Sure. It's a fairly new program,
It's
so
very
I
new.
think that's probably to be expected to
Yeah.
some extent.
Yeah.
Yeah,
And they're building relationships, right? And so this is sometimes one of the first times families have an individual that's just there for them. And so it's it's exciting for them and it's I'm sure also like wow, this is all just for me and my kids. um we do have currently have a family where the mom is a battered woman, and so um that's a unique situation that we've not dealt with, and we're trying we she needs support on like how to leave the situation, and so that's a higher level referral, right? And but my LCMs are all women and they're all wanting to find ways, safe ways for her to leave this situation.
yeah, yeah. I mean, it sounds like in Alameda County where it's been happening the longest, I'm sure that there's unfortunately huge need for this program and definitely I think it's I would have I could easily see situations where it just will take time
Hmm.
in order to for people to meet their goals to ensure that everything that they need is met. So
Right.
um yeah, and we're talking very early, so I think that makes sense.
Hmm.
And it sounds like, correct me if I'm wrong, but this this is a totally new staffing that's been done for this program.
Correct. Completely new. And in Alameda, we were approached by Chabot College to partner with them in hiring apprentices. So these are individuals that have experience, have been system involved, and are wanting to go to school. Like these are individuals that are working on getting their AA degrees, right? And so the partnership is one where we have these beautiful individuals. Two of the three of our LCMs are apprentices, and they come with a high level of experience because they've lived in this world in different ways. Like either they've been in foster care or they're fostering their own relatives, right? Or have. And but they want to go back to school and be social workers. They want to, give back in a way, right? So the two apprentices are AFS employees going to school, and this was an opportunity for them to get their feet wet, right? And they came at a perfect time. We had just started talking about ECM, and then concurrently the apprenticeship program approached us, and it was just like a beautiful fit because the two are a wealth of knowledge in terms of even resources because they've had to either research resources that for themselves or they've been linked to some of these resources for themselves, right? But they are all brand new employees, the three.
Yeah, wow, amazing. And I would imagine too, there's probably something to be said about having someone, not just an individual, but an individual who can be so highly empathetic,
Mm-hmm.
who really understands maybe kind of some of the nuances and specifics of what it's like to be in such a hard situation.
Right. Yeah.
So I think my last question is as far as sort of what the future looks like
Uh-huh.
for ECM. It sounds like there's already been some pretty active expansion plans. It
Yes.
sounds like it's kind of based on early results. There's unfortunately a need, and so the plan is, I guess, pretty soon to have it within just about all of the counties. It seems like that AFS services.
We have so in Sacramento, they have been receiving referrals, and same as San Francisco and Sonoma. They haven't expanded yet to the point where Alameda's at because we started earlier. Um, so the only other counties that we have the green light to support, not Napa and Solano, I believe we haven't received referrals yet. But it is the plan, and Full Circle is contracted with several agencies like ours to funnel these referrals through. And so but AFS stands out because we pick up their calls. We accept referrals. Um, it's important for us to serve these individuals, and we have excited employees that want to support these families. So we've received a lot of kudos because the supervising LCMs, they are just accessible all the time. And that's really just AFS in general. I feel like any service delivery, we're accessible individuals, and if we're not, there's always somebody else that can support them.
Nice. Well, we've covered a lot. Is there anything else that you wanted to add that we haven't touched on?
Uh, no, I think that was it. Yeah.
Amazing. Yeah, it sounds like a really incredible program. It's definitely a very exciting new direction, I think, for AFS. And so, um, yeah, really excited to see where this goes.
Me too. we are 6 months in, and so it's been it's been great. And I have to say that the LCMs, for being brand new employees coming into a brand new program as their first job within our agency, right? They have just like flourished. I mean, and these are individuals that are in school too. All three are in school. Two of the three are apprentices, but the other individual is finishing her bachelor's degree. And um, so that's really cool to watch, just from we've started from ground up and they've been a part of that whole process.
Amazing. And I'm sure it's a lot. The role sounds like it'd be very um it just would take a lot to do well, and they're doing
Mhm.
for folks to do this and school. I tip my hat to them.
Yeah.
That is um
And running
wow.
their own families, like these are individuals that have families and children to take care of themselves. But it was a perfect fit. I'm telling you, the timing of ECM and the apprentices was just like, wow.